doing today?
I'm good, thank you.
Good. My name is Jessica Halford. I'm going to be the physician assistant working with you today. Can you just go ahead and confirm your name and date of birth for me, please, sir?
Yes, Justin Halford, January 3rd, 1997.
Perfect. Looks great. So I'm going to go ahead and wash my hands. We can get started. I see you're here for a full cardio exam. Is that correct?
Yes.
Perfect. So I'm just going to go ahead and review your vital signs real quick, and then we can go ahead and get started. Perfect. Everything seems within normal. So first what we're going to do is I'm going to take a look at everything, and I'm going to feel around your neck, measure some things, then feel around your chest. I'm going to listen to a few things, and then after, if you have any questions for me or any concerns, we can go ahead and address those specifically. Does that sound all right to you?
Sounds good.
Perfect. So upon first impression, the patient does not seem ill, does not seem in any distress, no shortness of breath, no diaphoresis. Skin seems to be of good color. There is no chest abnormalities or no malar flushing on the face. There's no any scars or any signs of recent surgery, no defibrillators, so that's great. So first, Mr. Halford, I'm going to go ahead and I'm going to take a look at your neck veins. I'm going to inspect, and then I'm going to palpate, and then I'm going to listen. All right, so first I'm going to go ahead and I'm going to locate the internal jugular vein, and it's typically right about in these two areas. And I do see slight biphasic pulsations. And then typically, if we were in our regular setting, I would go ahead and move to the other side of the bed, but we are not, so I'm just going to go ahead and do my best to look from this side. And I do see biphasic pulsations as well there, so that's good. And then now I'm going to go ahead and I'm going to measure the jugular venous pressure, so I'm going to locate the point of maximal impulse. And typically it's slightly hard to see, but I can locate it on him, and it seems to be about right here. So I'm going to go ahead and measure that. I'm going to find the sternal angle. I'm going to use my nifty ruler device that I made up, and I'm going to go ahead and measure. And it seems to be about 1.5. So I'm going to go ahead and I'm going to add 1.5 to 5. And that is about 6.5 centimeters, so that's good. That's well within the normal range of abnormal, or the abnormal range of 8. Perfect. So now I'm going to go ahead and I'm going to assess the carotid artery. And it does seem to have, then I'm going to assess the other side. And they seem to be equal and bilateral swift upstrokes. Or brisk upstrokes. Now I'm going to go ahead and I am going to palpate for the carotid artery and feel for any abnormal pulsations. Everything seems right here. So now I'm going to go ahead and I'm going to listen. I'm going to listen to 3 spots. Right up here under the jawline. I'm just going to go ahead, have you breathe out and hold your breath, please. Perfect, and again. All right, and one last time. Perfect, everything sounds good there, no concerning sounds. And then typically I would go ahead and I would listen to the other side as well. So then now what I'm first going to do is I'm going to palpate for the point of maximal impulse. Typically it's about mid-clavicular line, 5th intercostal space. So I'm going to go ahead and march my fingers down. And it's about right here. So Mr. Halford, if you wouldn't mind just kind of rolling over a little bit on your left side so I can get a better feel for this. Thank you. Perfect, and I can feel the point of maximal impulse. It does seem to be a slight tapping sound, which is good because there's no abnormalities there. So while I have you in this position, I'm just going to go ahead and take a listen to it too, so I don't have to have you flopping all over the place.
Okay.
All right, and then I'm going to go ahead and listen with the bell. Perfect. So you can go ahead and you can lay back flat. So then now I'm just going to take a feel everywhere else. So I'm going to start back here at the about the 5th, 4th intercostal space, mid-clavicular line. And then I'm going to move over to the 4th intercostal space of the lower left sternal border. And then I'm going to slowly inch my fingers up to the 2nd intercostal space of the left upper sternal border. And then I'm going to go across to the right 2nd intercostal space of the upper sternal border and feel it there. And then next I'm going to go ahead and I'm going to place my palm and feel for thrills on any part of his chest. So first I'm going to start right here. All right, and then I'm going to go like this, and I do apologize. And then I do not feel anything there. So now, next I'm going to go ahead and I'm going to feel for any heaves. So I'm just going to use my palmar surface and my fingertips. So first I'm going to feel for anything right here. And I do not, and then right here. One more time across the body. I apologize for the awkward angle, Mr. Halford. Alright, so everything sounds good there. So then now I am going to go ahead and I'm going to take a listen. So first I'm going to listen to all 4 areas with my diaphragm, and then I'm going to go ahead and I'm going to listen with my bell in the 4th mid-clavicular intercostal space, and then the 4th lower intercostal space at the left sternal border. So here I am. I'm going to palpate the carotid simultaneously to ensure no abnormal heart sounds. And then I'm going to move over to this 2nd left intercostal space. And then inch my stethoscope down to the lower left sternal border, 4th intercostal space. And then I'm going to go ahead and move to the mid-clavicular line, 4th, 5th intercostal space. All right, so then now I'm going to flip my stethoscope over, listen with the bell, and assess further. I already assessed this in the left lateral decubitus position, and we established there was nothing there. I'm going to go ahead and listen right here. All right. So then, Mr. Halford, I'm just going to have you do one more thing for me. Would you please just sit up and then drape your feet over the side of the bed or chair? All right. And then I would like you to just slightly lean forward. I'm going to have you take a breath in, and then after you exhale, hold your breath, please, for a moment, and then I'm just going to listen to your heart. All right, and we do that one more time. Perfect. All right, so you can go ahead and you can lay back for me. All right. So Mr. Halford, I looked, I've listened, I felt, I measured your jugular venous pressure. Everything seems well within normal limits for me. I can't find anything else to look at. Nothing's of any concern to me. Do you have any questions?
I do not.
No, you do not? Okay, perfect. Well, we'll go ahead and,
Yep.